Yeah, absolutely. And you found a way to use technology to give you the information that you need, but at the same time, keep the privacy for that resident. And I think that that's one of the key differentiator for your product that I really like about it. And now the return on investment, we talked about obviously the resident's health and safety. That is probably the number one return on investment. But dollar value wise, you also talked about saving time, but with the nurses' aides and so on, getting information, not being able to track that information before. But what kind of other ROIs would you say your product brings that a facility would say this is worth it for me to put in here, outside of, let's say, the resident care aspect of it?
Yeah, so there is a cost. Every facility, regardless of the jurisdiction, the costs differ a little between Canada and the US. But there is a cost of falls. There's a cost to hospital readmissions. There's a cost to the facility, for resident transfers and emergency department admissions. There's a cost to the facility for vacancies, and if a resident has to leave to go to a hospital long term because of injury, now they have to get another resident in. So there are measurables that our system, if you're reducing the causes of or identifying potential causes of illness through changes in activity, early intervention results in better outcomes and better health for the residents. So you're not only reducing trauma for the residents, you're having a measurable impact on costs for the facility. And for retirement facilities, we're providing a competitive benefit for them by they can go out and market their facilities as while still being privacy compliant, a much safer facility for seniors to live in than their competitors. So that can increase their revenue and increase their bottom line. The increase or the cost savings shouldn't be underestimated for the time savings, though. Like that is a big component where if we can allow facilities to increase direct care time without adding headcount. So now if staff if they can reduce their care planning or their assessment time across the continuum of care, if they're not responding all the time to, for instance, bed alarms, because we can detect those movements in bed, and bed alarms aren't really that good at it because again they're pressure based. They're typically going to go off when the resident is on the floor. So again, it's something that they're only responding to. All of those things are measurable. That when the staff can be redeployed to be doing direct care rather than busy work, rather than administrative work, rather than or we can reduce the time for care planning and assessments. Those are all measurable. That's all important, and it provides the facility the ability to provide a higher level of care, a higher quality of care without adding headcount. So our measured ROI, again, and we've tested this with our facility operators, is roughly 16 months. After the capital costs of the hardware for the solution and the installation, they're ahead of the ROI. The cost benefit comes out around 16 months.
That's incredible.